Do you ever have chronic neck pain patients who have symptoms in the back of the neck and you hammer the back of the neck and you wonder why aren't they getting any better? Well, that's often because they often have tons of adhesion glue in the front of the neck. In this treatment visit, you're gonna see my good friend Lori, who is 55 years young and has had over 15 years of chronic pain around the left side C2, C3. And first you're gonna see James do a few different neck and shoulder tests with her, and then you're gonna see me jump into treatment, removing a bunch of adhesion all from the front of her neck, longus, colli, the nerve roots of the scalenes, all in the front, and then the results that we get when we retest her neck.
Visit 16, you made it.
I can't believe it.
How are you feeling since last treatment? Better, the same, worse?
A lot better.
Oh, great.
Yeah. Mm-hmm.
Last time you were here, you had 88% overall improvement. Would you say 90, 95?
I would say 90.
Great.
Mm-hmm. I don't feel the pain when I turn my neck. When
Or
I
is it
turn
moving?
my head to the left, I feel it here.
On the right side.
And then when I turn my head this way, I'm feeling it here as well.
This is visit 16 of Lori's case. Our cases are all 16 treatments long, and usually after 16 treatments, people purchase the longevity package, which is cheaper than the original case fee. And what's really cool about Lori's case, like we said in the intro, is that she's had chronic neck pain at the C2, C3 area on her left side for the past 15 years. So anytime that somebody says that their primary spot is gone and now they have a new spot, we Adhesion Release Methods providers call that unlayering. The body is like an onion with layers of compensation. The longer somebody has chronic pain, the body will try to work around it, develop a new compensation, then keep overutilizing other tissues until everything peters out and there's no other tissue to use. So we've unlayered the worst issue that she's had for 15 years, and now she's feeling it more on the right side, which is really awesome.
And computer work, any issues with that? Still
I'm
tightness
trying
up
to think
here?
if I did any computer work. No, not that I noticed. It was pretty
Okay,
good
great.
that day after, yeah.
When we do the initial consultation with any patient, we always get a diagnostic hypothesis after getting the 7 first order data points: age, sex, provocative, palliative, intensity, what did I mention? Quality and intensity. And one of her provocatives was after computer work, after 60 minutes of computer work, she'd have to lay down. So she just said that she was able to do her computer work for a day and not have any symptoms. So this is what it's all about. Sustained permanent pain relief means that people can go back and do the activities they want to do and not have to stop them, whether it's their work or something they love to do. And in this case, Lori is now able to do her job, which is sitting at a computer and make money, which is usually important to people as they get older.
Good. What do you feel right there?
Nothing.
Awesome.
No, right. I can't believe it.
Good. What do you feel there?
A pull right here on both sides.
On both sides?
Yeah, both sides. So like here
Got it.
and here. So
Got it.
maybe a 1.
2 on the right, 1 on the left. What do you feel there?
Yeah, actually it feels okay.
Nothing in the back of the shoulder?
No.
Notice all the testing we're doing with Lori to fully discharge somebody so that they need as minimal treatment as possible over the long term. They get sustained permanent pain relief. We have 5 cervical neck tests, 3 thoracic tests, and 1 shoulder test that all need to be as close to 100% passing as possible. So in this re-exam during this treatment visit, you're seeing 4 or so tests that James is doing right now to make sure that we're getting as close to 100% as possible. Are we going to get 100%? No. It's just about getting as close as possible. The range of motion will dictate how much symptoms she's going to have in the future. So this is longus colli. She's doing 90% better. She's doing super well. Her symptoms are pretty much always up here. Anything we can do to unload the front of the neck and take stress off here to remove the adhesion so that this stuff isn't being all pulled down is going to cause this to work less over time. And this longus colli is often neglected by a lot of providers because it can be scary. The trachea and esophagus are there. What's that called? The carotid arteries right there. So you have to feel the pulse and then you move the throat out of the way. And then you can get into here and feel where longus colli is. And then also longus colli can be attached to the carotid artery. So sometimes if this causes a dizziness or some other type of symptom, you remove the adhesion and then that symptom can stop bothering the person. Something I wanted to let you guys know about is our free 5-day find, feel, and fix the worst spot for chronic sciatica challenge that you can find by clicking the link here. This is a mini course on how to feel nerves, the biggest nerve in the body, how to see if it's stuck by adhesion or if it's swollen or entrapped, how to set up to generate tension on it, because it's tension that actually breaks adhesions, and then how to do a treatment pass even if you don't have an assistant. The idea with this challenge is that I wanted hardworking providers, chiropractors, massage therapists, physical therapists, naturopaths, osteopaths, whomever, who want to fix a very common problem where people have chronic symptoms and aren't seeming to get relief. Usually the primary cause for that is adhesion in this spot. So if you go ahead and do this challenge, the idea is that you would be able to go and help them get 10, 20, 30, 40% relief in 1 to a few treatments. And then you might be interested in talking to us to apply and see if you are qualified to become an Adhesion Release Methods provider. The back of her levator scap top here feels like it's stuck to the underlying tissue. I didn't.
It's like a little pop.
$40 at the door. Chiropractic joke. Because of the nature of Lori's initial injury when she was 10 years old, I could feel the facet joints at C2, C3 are much thicker and bonier than they should be otherwise. This is hallmark osteoarthritis. Therefore, what I'm doing now is I'm treating the rotatories muscle. Any of the small stability muscles are more important when somebody has joint arthritis like this, and it's more important that they be clean and adhesion free because they need to stabilize the joint. C6 nerve root at middle scalene.
Great.
One pass, mild to moderate.
Oh, that's really tender in there.
You okay?
Mm-hmm.
Two passes, longus colli on the right, moderate. C3 nerve root anterior scalene. Moderate to severe.
Oh, it hurts.
I know. Two passes.
74. Before it was 69 in the beginning.
Oh, really?
Yeah.
That's good.
Yeah.
You know, I like to see the progress.
Yes, you do. What did you feel there looking left?
Like a little twinge in this spot right here.
Yeah.
Just like a little
that-
twinge. Nothing major though. No throbbing or anything.
Good. What do you feel there?
I don't feel anything.
What do you feel there?
Just a teeny tiny pull right here on the same spot, but
Got it.
like maybe a 0.5.
Got it.
You're doing great though.
Yep.
Again, most of the tissue is much softer,
Right.
much better.
Mm-hmm.
This is just still a little bit irritated and contracted.
Right.
Whether that's coming from the degeneration or my skill set not being good enough is hard to say. With time, I may be able to unwind that and
Mhm.
soften it. With strengthening and you being good about your body,
Yeah.
that may be able to calm down and relax.
Mhm.
But that's just, in an ideal world, I'd be able
Yeah.
to make all tissue just soften and relax because you would have more longevity from the tissue perspective and how infrequently you would need treatment if
Yeah.
that were true.
Mm-hmm.
So I'm just relaying to you what I'm feeling and what my expectations would be. Lori said it used to be like a rock. I said this is so much softer. That is the entire goal of treatment, that people can notice that their tissue gets softer over time, not just within the treatment visit, because it needs to get softer within the treatment visit, but from visit to visit to visit, because only then can we expect permanent sustained relief. But I'm super happy with
Yeah, me too. Unbelievably happy. Like, I can't believe I can like move my neck now and not always be aware of this pain and throbbing. So thank you. Appreciate it so much.